Hello everyone, this lecture is going to be covering the material from chapter 8 of your Merib text, which is about joints. This is a very short chapter. There's not too many slides, 33 to be exact, so there will just be one lecture for this. And the material is relatively straightforward, but it's important that we understand the different types of joints and articulations, and movements, because when we get into talking about the muscles, especially in lab, it's going to be important that you know the basic information so that you can better understand the movements of specific muscles in the body. Okay, so joints, also called articulations, are just the site where two or more bones meet. And there's a few different functions of joints. Some give the skeleton mobility and help create movement, and other types of joints help hold the skeleton together. Okay, so depending on what type of joint you have, you're either producing mobility or stability. And there's two different ways we classify joints. So the first is a structural classification, and that is just based on what material binds the joints together and whether or not there are cavities present. So we can have fibrous joints, cartilaginous joints, and synovial joints. And there's also a functional classification. And the functional classification is based on what kind of movement the joint allows. Okay, so there can be synarthroses, which is an immovable joint, amphiarthroses, which is slightly movable, and diarthroses, which is a freely movable joint. So normally when you think of joints, you're probably thinking of a diarthroses, like the joints in your arms and legs, right? When you're walking, the things that are moving. But the other two types of joints are also present and are going to be things that you don't normally think about, like the joints that hold your skull together or the teeth in their socket, right? Those are two bones meeting, so they are still technically joints. We're going to really talk about the structural classification because it's easier to classify and kind of divide the different joints into those categories. But we will, for each of the different structural classifications, kind of tell you if it's what kind of functional classification it is as well, if that makes sense. Okay, so let's go through these three structural classifications in more detail. Okay, so let's start with the fibrous joints. Fibrous joints are going to be joined together by dense fibrous connective tissue. Okay, so the name tells you fibrous, you're going to have fibrous connective tissue. There is not going to be a joint cavity. And most of these types are immovable, so synarthrotic. And it just depends on the length of the connective tissue fibers. So if you have a little bit of a longer fiber connecting the joint, you may have a little bit of movement, but most of them have really short fibers, which are holding the bones really tightly together. So there's not going to be much movement. Okay, and we can further break down our fibrous joints into three types. We have sutures, Syndesmosis, and Gomphoses. I don't know how to say those, so I apologize. They're probably wrong. But as long as you can read them and tell me what they are, that's good. So, okay, all of those are fibrous joints. So let's talk about each one of those three in a little more detail. So sutures are the first type of fibrous joints we're going to talk about. So they are the rigid interlocking joints of the skull specifically. Okay, so the sutures allow for growth during youth. So they, when the child is developing, contain connective tissue fibers that allow for expansion. So we talked about bone growth in previous chapters. Okay, so that fibrous tissue is going to allow the bones to grow. In middle age, the sutures are going to ossify and fuse together to create a solid connection between the bones. Okay, so once they ossify, then you have an immovable joint that joins the skull bones together, which is important because it helps protect the brain. Okay, these closed immovable sutures are referred to as Synostoses. Okay. So again, examples of that are the bones in your skull only, right? So you can have the different bones of the skull, right? And the little lines you're going to see between them are sutures, okay? Which again is a type of fibrous joint. And in lab, you should have learned the names of all of the bones. So you should know the names of specific sutures in the skull. So right between your frontal bone and your parietal bones. So this is your frontal bone. You have your parietal bones back here. You have your coronal suture. You have your squamous suture between your parietal and temporal bones. And then between your parietal and occipital bones, you have your lambdoidal suture, okay? So those are all different types of these sutures. Okay, the next type of fibrous joint are the syndesmoses. So they're going to be bones that are connected by ligaments, right, which are just bands of fibrous tissue. So ligaments connect bone to bone, okay? So anytime you see a ligament, you know it's bone-to-bone connection, which is what makes this a joint, right? Okay, you can have these types of joints with varying length of these connective tissues, so the amount of movement varies, right? So if you have just a really short ligament, there's not going to be much movement between the two bones, but in some areas you're going to have longer ligaments, which allow for a little bit more movement. Okay, so an example of a short fiber with little to no movement is the inferior tibiofibular joint. Okay, so if we have our tibia and our fibula, remember the fibula is the little lateral bone, so the bone on the outside of our leg. The tibia is the wider one that's more medial. At the very bottom of it, you're going to have a ligament that holds them together. So that is going to be very short fibers that offer no movement. Some examples of longer fibers that allow more movement is the membrane that connects the radius and ulna. Okay, so our radius and ulna we're able to kind of twist around, move a little bit more than the bones in our legs. So it's important to have a little bit longer connective tissue to allow for more movement. Okay, and then the last type of fibrous joint is these Gomphoses, which are also known as peg-in-socket joints, which is a lot easier to say. And the only example we have of this is the teeth in the alveolar sockets in our gums. Okay, the fibrous connection here isn't as easy to see. It's called the periodontal ligament. And that's again, connective tissue ligament that's holding the tooth into the socket. Okay, so again, remember, joints are bone-to-bone connection. So these sockets that your teeth are in are obviously going to be part of your mandible in the skull, right? Or your maxilla, depending. Remember, mandible is the bottom part of your jaw, maxilla is the top part. So you're going to have bone, and in the middle, you have this ligament. So this white, that's now orange space, is a ligament that's actually holding the tooth, which is here, obviously, into the socket. Okay, so the tooth's a bone, your maxilla or mandible is a bone, and the ligament holds those in the socket. Okay, so those are the three types of fibrous joints. The second classification of joints we have are the cartilaginous joints, which the name tells you they're going to be bones that are united by cartilage. Like fibrous joints, they also have no joint cavity. Okay, so there's not going to be a space, just tissue holding the bones together. They're not highly movable. So they're going to be a little bit more movable than some of the fibrous joints, but still not, extremely movable. And again, there's going to be a few different types. So we have the synchondroses and symphysis. Okay, so first, synchondroses, again, cartilaginous. You have either a bar or a plate of hyaline cartilage that's uniting the bones. Okay, so you're going to have hyaline cartilage uniting two bones, right? That makes it a joint. Most of these are going to be synarthrotic or immovable, right? No movement at all, immovable. Okay, some examples of these are the epiphyseal plate, right, which you can find between the parts of your bone, your epiphysis and diaphysis. So your epiphyses at the end and diaphysis in the middle. So remember, the plate is the hyaline cartilage joint where bone growth occurs, right? Eventually that's going to ossify as well. And it's going to become a syndemosis, kind of like the sutures, after the bone ossifies. So after it ossifies, okay, because then it's going to become only bone. And you can also have a cartilaginous joint between the ribs and your sternum. So between the first rib here and sternum, you have a hyaline cartilage connective tissue that is going to hold the ribs to the sternum, which is also considered a cartilaginous joint. Okay. The other type of cartilaginous joint we have are symphyses. So in symphyses, we have fibrocartilage that's uniting the bone in the symphysis joint. So this last type, remember, we had hyaline cartilage. In synchondroses, in symphyses, we have fibrocartilage. Okay, you can have hyaline cartilage present in these joints, but only as articular cartilage. And remember, articular cartilage is going to be covering the bone surface directly. So if we look, I'm going to zoom in right here. So you would find articular cartilage right along the bone surface to help protect it. But the actual bone, the cartilage, that's holding the bones together is always going to be fibrocartilage in a symphysis. Okay. Symphyses are going to be amphiarthrotic, which means slightly movable, so allow for more movement than the diarthrotic joints. Some examples of these are our intervertebral joints. So again, the joints between the vertebrae and our spine. And also our pubic symphysis is a really good example of a symphyses joint. Okay. Again, always going to be fibrocartilage holding these together. And the last type of joint is our synovial joints. And this is kind of the majority of this chapter, talking about synovial joints, because there's a lot of information on synovial joints. Okay, synovial joints are separated by fluid-filled joint cavities. Okay, so the other types of joints did not have any cavities, but synovial joints do. So that's the only joint that has a cavity is synovial. They're going to be diarthrotic, which means they're freely movable. So these are the joints that you think about like in your arms and legs, that you have a wide range of motion. And they include almost all the limb joints, okay? So all the ones in your appendages. There are some characteristics of synovial joints you're going to have to know, and we'll go through all of these in future slides, but they have 6 general features, have bursae and tendon sheaths associated with them. The stability of these joints are influenced by 3 factors that we'll talk about. They allow for several different types of movements, and they're classified into 6 different types. Okay, so the rest of this chapter will just be talking about the different types of synovial joints, their different movements they allow, and what, different structures you'll find there. So for the general structure of a synovial joint, okay, you're going to have articular cartilage present, okay? The articular cartilage, again, we've talked about this previously, is going to be the cartilage that's directly covering the surface, the ends of your long bone. Okay, articular cartilage is just preventing crushing or, the wear and tear of the bone ends that are going to be in close contact with each other. And articular cartilage will be hyaline cartilage. Okay, all synovial joints are going to have a synovial cavity. So this space in the middle between these bones, right, is the joint synovial cavity. It's going to be a small fluid-filled space that, again, is going to be unique to synovial joints. So you're not going to find it in any of the other joint types. Okay, so it's going to be fluid-filled in that space. And you're going to have an articular joint capsule, which is 2 layers thick. So we have an external fibrous layer, which is made of dense, irregular connective tissue, and an inner synovial membrane. That's going to be loose connective tissue that's responsible for making the fluid that fills the cavity. Okay, so you can see if we zoom in, the articular capsule over here, the outside layer is the fibrous layer. So this layer here, again, made of dense, irregular connective tissue. And then deep to that, we have the synovial membrane, which is a loose connective tissue. So this layer right here, it's hard to see these colors, but the more inner layer, that's going to be making the synovial fluid and releasing it into the joint cavity. Okay. Some other things that we also are obviously going to have in synovial joints is the synovial fluid, which again is going to fill that joint cavity, right? Contains synovial fluid. It's very viscous, which kind of means thick, slippery filtrate of plasma and hyaluronic acid. It's going to lubricate and nourish the articular cartilage, so making sure that that cartilage cells, chondrocytes get the nutrients that they need and are nice and slippery to avoid extra wear and tear. And then it also contains some phagocytic cells that remove different microbes and debris to help make sure that we don't get any sort of infection. Okay, there's also going to be some reinforcing ligaments, and I'm not going to ask you to identify them, but there's ligaments on the outside of the synovial joint. We have capsular ligaments, which are thickened part of the fibrous layer. We have extracapsular, which are outside of the capsule together. And we have intracapsular, which are going to be deep inside, deep to the capsule, surrounded by the synovial membrane. Okay, and those are just there to help reinforce the joint because we do have so much movement. It's really important that we have those ligaments to help hold the bones together so that they don't fall apart during movement. Okay, and finally, in synovial joints, we are going to have a number of nerves and blood vessels innervating. So nerves are there to detect pain. They also monitor joint position and stretch. So our ability to kind of know where our body is in space. And if we know our arm is bent, knowing how that we should straighten it to reach something, or vice versa, we know our arm's straight and we need to bend it this way to grab something is due to those nerves that are monitoring the position of our joints. And the capillary beds, the blood vessels, supply the filtrate for synovial fluid. So remember, the synovial fluid is made from the plasma of our blood. So obviously we need to have some blood vessels or capillaries in, again, the synovial membrane that are going to use their filtrate of plasma to create that synovial fluid. Okay. There's a few other features of synovial joints. There are fatty pads that are extra cushioning between the fibrous layer and the synovial membrane. So you can't really see it in this. So between the fibrous layer and synovial membrane, so you'll have fatty pads kind of in here, right? Which, again, you can't see it in the image, so I would not ask you to identify that. And then articular discs or menisci, which are discs of fibrocartilage that are going to separate the articular surfaces to improve the fit of the bone ends, stabilize joints, and reduce wear and tear. Okay, so you're going to see that in areas like your knee, adding another extra layer of fibrocartilage to help strengthen the joint and reduce wear and tear, especially in places that are weight-bearing and going to be a lot of weight on each other. Okay, so those are the characteristics or features you can find of synovial joints. Okay. Also in synovial joints, you're going to find bursa and tendon sheaths. Okay, the bursa are basically just like bags of synovial fluid that act as a lubricating ball bearing. Technically, they're not part of synovial joints, but they're closely associated. You're going to find bursae at the synovial joints. Okay, so basically bursae's function is to reduce friction where ligaments, muscles, skin, or bones rub together. So again, they're just going to be these little like fluid-filled balls that are going to kind of roll with the joint to help, reduce the friction. Okay, so we see in these images here, those little balls are going to be the bursa. Okay, so in this example, we have the acromion of our scapula, our humerus down here, and this would be our scapula, the glenoid cavity of our scapula. So again, you're going to have these little bursa in different areas that are going to help with rolling, making sure that we have less friction in those areas. Okay, we also have tendon sheaths, which are similar to bursa. They're kind of these like little balls, but they're elongated. And they're going to be wrapped completely around tendons that are subjected to extreme friction. Okay, so again, in this image here, we can see this part, the tendon sheath, okay, is this whole area is going to wrap around the tendon, which is this part. It's going to wrap around the tendon that goes around our humerus here, and just, again, provide a little bit of extra protection in areas that have a lot of friction. Okay. 3 factors determine stability of synovial joints, which is important because it helps prevent dislocations, which obviously aren't good. So the shape of the articular surface plays a minor role in stability. So shallow surfaces are obviously going to be less stable than kind of a ball and socket joint. So think of like your head of your femur, which you should know, and the acetabulum of your pelvis. That would be a ball and socket. And that's going to be really stable because you have a lot of area for connection, and that articular surface is quite large. There'd be a lot of surface area. Okay, we have ligament number and location. So like I said, there's going to be a number of reinforcing ligaments around a joint. Some are going to have more than others. The more ligaments, obviously, the stronger the joint's going to be. Okay, so those ligaments are going to be made of that dense connective tissue, which is really important because it's very strong, withstands a lot of tension. So the more ligaments we have, the better. And then the most important thing is muscle tone. Okay, so muscle tone we'll talk about in the next chapter, but it's going to keep tendons taut as they cross the joints. Okay, so remember, ligaments up here connect bone to bone. Tendons are muscle to bone. Okay, so as those tendons cross the joint, if we have good muscle tone, it's going to help reinforce these joints, and it's especially important in the shoulder and knee joints, as well as the arches of our foot, which you wouldn't really think of, but there's a lot of weight that's going to be put on there, so it's really important. Okay, so this is just all of the joints in your body and the different names of the joint, what bones articulate, the structural type and functional type. So if you're ever interested in memorizing all of these, you can look at these and see the different types. I'm not going to ask you specifically. The main ones that I gave examples of before are pretty straightforward, and you should know those, the structural and functional type, but I'm not going to make you match all of these. That would be ridiculous, but they're all here if you want to take a look and kind of practice getting, being able to classify the different joints in the body. Okay. All right, so some more synovial joint information. We have different types of movements that synovial joints allow. right? So we have a number of different synovial joints all throughout our body, in all of our appendages, really. And there's a lot of different movements that they can produce, okay? All the muscles attach to bone or connective tissue at no fewer than 2 points, which gives us 2 points of attachment for each muscle. And again, muscles are what's going to be creating the movements. The synovial joint is what's kind of allowing for specific movements, but the muscles are actually doing the movement, okay? So these kind of go hand in hand, the muscles and joints. But each muscle, you're going to have an origin and an insertion. And in lab, when you have to memorize the muscles, you're also going to have to know their origin and insertion points. Origins are always going to be attachments to immovable bones. Okay, so origins are never going to move. Insertions are attachments to movable bones. Okay, so when you contract your muscle, the insertion is going to move towards the origin. Okay, and that's going to produce a certain type of movement. Okay, so again, insertion moves towards origin. And movements can occur along any of the planes, so transverse, frontal, sagittal planes. And there's different names for each of these different types of movements that we'll talk about in a minute. Okay, so there's different ranges of motions that are allowed by synovial joints. So non-axial are just referred to as slipping movements. So we'll talk about that a little bit more in a minute. Uniaxial is just a movement in one singular plane. So again, think of the planes we just talked about. So you have the frontal plane, transverse, and sagittal, right? So only moving in one of those planes would be a uniaxial movement. Biaxial is movement in 2 planes. So if you move in a frontal and transverse at the same time, that would be biaxial. And multiaxial is movement in around all 3 of the planes. Okay? And there's 3 general types of movements: gliding, which we'll talk about these more in depth in a second, angular movements, and rotations are the 3 main divisions. Okay, so we're going to really talk about these types of movements, and you should be able to classify each movement type based on its range of motion. Okay, so the first type of movement we're going to talk about is gliding. So a gliding movement happens when one flat bone surface glides or slips over another surface. Okay, so this happens in your intercarpal joints. So the carpals are the little bones in your wrists. Intertarsal joints, which are the bones of your feet or ankle. And then also gliding movements happen between the articular processes of the vertebrae. Okay, so you just have a little bit of gliding over each other, not really much movement at all. Angular movements was the second main type, and there's a lot of different angular movements we're going to talk about. Angular movements increase or decrease the angle between 2 bones. Okay, this is going to be a movement along a sagittal plane. So if it's in one plane, that's uniaxial. Uniaxial? Yep. Sounded weird when I said it. So we have a few different types of angular movements. Flexion is decreasing the angle at the joint. Extension is increasing the angle at the joint. Okay, and hyperextension is increasing the angle at the joint beyond the anatomical position. Okay, so if your head is, your neck here is the joint we're looking at. Flexion, we're decreasing, so you're starting here. Flexion, we're decreasing the angle at the joint. Okay, so flexion. Extending, we're increasing the angle at the joint, only to the anatomical position. And if we move past the anatomical position and end up with an angle greater than what you'd see in the anatomical position. That's hyperextension. Okay, you could do the same thing in your torso. Flex is you're decreasing the angle, right? Extend, you're increasing the angle. And hyperextend, you increase past anatomical position. So again, you can do this with your leg as well. If your leg normally is here, flexing, you're decreasing the angle. If you're looking at your knee joint, you're decreasing the angle. Extend would be increasing the angle there. So on and so forth. Okay, so when we talk about the muscles, flexion, extension, hyperextension are going to be movements that you're going to see muscles performing. We also have additional angular movements. So we have abduction, which is a movement now in the frontal plane, away from the midline. Adduction, again, frontal plane, moving towards the midline. So, again, if you know the midline of your body is the line that goes directly through the center. If you're going closer to the midline, think of it, you're adding, right, towards the rest of your body. So adduction is towards the midline. Away from the midline is the other one, abduction. Okay, so I think adduction, you're adding towards the midline of your body. Okay, and you can also have circumduction, which is flexion, abduction, extension, and adduction all at the same time, which basically you're just creating a circle, kind of like a cone in space. Okay, so the most proximal point of your joint isn't moving. The more distal it is, and you're creating kind of like a circle. Okay, and that's called circumduction. Okay, you can also have rotation, which is the turning of a bone along its own long axis, either towards the midline or away from it. So medial rotation, you're rotating stuff inwards towards the midline. So if you take your left foot here and medial rotate it, your toe is going in. A lateral rotation is away from the midline, so that's rotating your toe out towards the outside of your body. Okay, you can do that with your arms too. If you're in anatomical position, with your palms forward, if you bring your thumbs towards your body, that would be medial rotation. Lateral rotation is bringing your thumbs out away from your body. Okay, and there's also some special movements we'll talk about. We have supination and pronation, which is specifically talking about the rotation of your radius and ulna. Supination has your palms facing anterior. Pronation is palms facing posterior. Okay, so supination, pronation. Then you have dorsiflexion and plantar flexion of the foot. Dorsiflexion is bending your foot towards the shin. Plantar flexion is pointing the toes. Okay, so if you put your toes towards the sky, dorsiflexion, flexing your foot if you've ever been a dancer, flexing the foot. Pointing the foot is plantar flexion, putting your toes down. A few more special movements. We have inversion and eversion of the foot. Inversion is where we have the sole of the foot facing medially. Eversion, sole of the foot is lateral. Again, it's a special movement because you can't do it at every joint, only at certain joints. Protraction and retraction are movements that happen in the lateral plane, which again is kind of special because you can't do that in many areas of the body. Protraction, an example of that is your mandible jutting forward anteriorly. Retraction is when your mandible is pulled back. Okay, so more posterior. Protraction, out. Retraction, in. And then the last types of special movements, we have elevation and depression. This is an example of, you can have your mandible, but it can be other areas too. So this picture shows your mandible. Elevation is lifting something superiorly. Depression is lowering it, so making it more inferior. So your mandible can do this. If you close your jaw, that's elevation. Open your jaw, that's depression. Your shoulders can also elevate. If you were to shrug your shoulders up towards your ears, that's elevation. Depression is relaxing your shoulders down. And then finally, the last special movement is opposition, which is the movement of your thumb. Okay, which your thumb can do a lot of fancy movements. So touching your thumb to the tips of the other finger or any type of grasping movement is considered opposition. Okay. So these are all the different types of movements and definitions of them. Okay, so remember we have three main types: the gliding, angular, and rotation. And then we also had a few of the special movements, and those don't fit into these categories. Okay, but you should know the different types of movements and be able to give examples and understand what the definition of each is. All right, and then the very last part of this chapter is the different types of joints. And there's 6 different categories. They're based on the shape of the articular surface, so the surfaces that are touching, as well as the movement that the joint can do. Okay, so these are the 6 of them, and there's a slide for each of them. So we'll go through plane joints, hinge, pivot, condylar, saddle, and ball and socket. Okay, so let's start with plane joints. So I'm going to change colors here. Plane joints, the name's up here. We have non-axial movements, right, which means you're not really moving in any action, in any any plane. There we go. So you're just going to have gliding type movements, okay? And in these plane joints, you're going to have flat articular surfaces, like the surfaces in your intercarpal joints, intertarsal joints, and between your vertebrae. Okay, so you're not really moving in any plane. You're kind of just gliding around a little bit. Okay, the next type is a hinge joint, which we have uniaxial movement, so movement in a singular plane. In a hinge joint, you're going to have a cylinder type shape and a trough, and it's going to allow flexion and extension to happen. Okay, so these are going to be joints such as the elbow and the joints between your phalanges. The phalanges are the bones in your fingers and toes. Okay, so for your humerus, right, we have this kind of cylinder at the bottom of your humerus and a trough at the top of our ulna that are going to fit together and allow for flexion and extension. Pivot joints also allow for uniaxial movement, so movement in a single plane. For a pivot joint, you're going to have a sleeve, which is most times a bone and also a ligament, kind of creating a sleeve around the axle, which the axle is going to be a rounded bone. So your radius and ulna here are an example. And it's going to allow for rotation, right? Because we have the axle in the sleeve that's going to be allowed to rotate. We have condylar joints, which allow for biaxial movement, right? So movement in 2 planes. Condylar joints, you're going to have oval articular surfaces, so kind of like a little teensy little cup and a rounded part here. So this is going to be mostly in the knuckle joints and some of the joints in your wrist. So because they allow biaxial movement, you'll have both flexion and extension and adduction and abduction. Okay, so all the stuff we talked about earlier in this chapter, we're really applying to these different joint types. So it's important you know the different movement types, different kinds of movements to understand each of these joints. Okay, next we have a saddle joint, which also allows biaxial movement. So again, movement in two planes. The articular surfaces are going to be both concave and convex. Okay, so we have a concave, convex, going to fit together, and a biaxial is going to allow for movement in two planes, so adduction and abduction, as well as flexion and extension. So the joints of the thumbs are going to be able to move in and out and flex and extend. And the last type of joint we have is our ball and socket joints, which are my favorite. They allow for multi-axial movement, so movement in all three planes, frontal, transverse, and sagittal. So ball and socket tells you you're going to have a spherical head and a socket or a cup that head fits into. So you have flexion and extension, adduction and abduction, as well as rotation. So all three planes. And this is going to be found in your shoulder and hip joints. Okay, so where your humerus, the head of your humerus attaches to the glenoid cavity of your scapula is a ball and socket. And at your hip, the head of your femur and the acetabulum of your pelvis is going to be another hip and socket, right? So scapula, this is your glenoid cavity and the head of the humerus. Those are the examples of ball and socket joints. Okay, so that is it for this chapter 8 lecture. Again, not too much information. And there will not be a part 2. So if you have any questions, let me know.